Hello, good evening.
Good evening, you're welcome. All right, go ahead. I'm with you. Good evening, Boss Jane.
Hello, good
Go
evening,
ahead.
doctor.
Good evening. Go ahead. I'm with you.
Okay. My question is about C-section.
C-section.
Yeah,
Okay, what about it?
I've already done 3 C-sections,
You've
and
done what?
I've already done like I've given birth to 3 kids, and they
Okay,
were
through
all
C-
3
C-section.
Yeah, and I'm pregnant again.
Mm,
I'm about to give birth. I think 5 days ahead of me. Yeah, this month.
mm.
I'm in Germany, and the doctor asked me to think about it, whether I'll remove my womb or not. I've been thinking about it several times. I don't know.
There must be what is the real concern?
I don't know. The doctor just told me to think about it because of my health. I don't know. Just
Mm-hmm. Okay, I would love to know what is in the mind of the doctor because he has your history, right? He has your history. There are things he has in your history that is not
no. I just came to
that will
Germany
give me
about
some clarity.
a few months ago,
Mm-hmm.
and I think the doctor just asked me that will I remove the womb or I just want it to be there.
So, do you have any health concern right now?
No, please.
How many kids do
Apart,
you have?
I have 3 kids.
Okay. Do you have the history of fibroid?
Yeah, yes. Apart from 5 years.
But in this pregnancy, is there any complication that is
No,
coming as a
please.
result of the fibroid or previous CS?
No, please.
So your doctor is a white man, right?
Yes, please.
Oh boy, of course, I should think so. Okay, so now this is what I can tell you.
Okay.
If there is no complication from as a result of previous C-section, if there is no
Okay.
current complication as a result of the of fibroid, if there is no symptom that is causing you discomfort or or stuff like that, well, I don't think hysterectomy is should be on the table. But if it's a question of say, madam, you're always doing CS, and we don't want you to conceive again, so let us now just take out your uterus. That is a different gist altogether. But if conception is a problem, they can actually do tubal ligation, right?
Okay.
So there must be a more concrete reason why he wants you to. But again, I know that um, white people have their ways of reasoning. But I feel like if there is no more concrete, you can just do tubal ligation if you don't want to have kids anymore, right?
Okay.
But if there is a more stronger reason, maybe you usually have a severe postpartum hemorrhage, If that is your case, then you begin to reason in that direction. But besides that, if it's just because they don't want you to have any more kids, just do tubal ligation and and rest, right? Is that okay?
Okay. What about the fibroid?
What's the size of the fibroid and where is the location? These are the more important information that will determine a lot of things.
Okay.
So the size of the fibroid, the location of the fibroid, and when, because you've done CS before now. So at what point did they discover that you had fibroid?
Since the first one.
Since the first one. So what's the current
Yeah.
size? These are kind of information I would like to get. What's the size right
Okay.
now?
The first one, doctor
And where is
told
the
me
location?
it's small. As for the location, I don't know.
Because where there will be concern is if the fibroid is a is at the cervix. In other words, it's covering the birth area, right? So of course they always definitely go for CS if you're not about to take it out. That's one. Number two, if it's large and competing space with the baby in such a
Okay.
way that the baby cannot grow very well. So that is a source of concern. But again, it's not so much of a concern that you want to take out the whole uterus. Yeah. So there are
Okay.
many several things to consider. But again, within the limit of what you are saying, that's what I can advise you. But your doctor has your complete history that should determine why they are requesting that you do a hysterectomy.
Okay. Thank you very much.
You are
Hmm.
welcome.
Okay, doctor. I just want to know at the age of 35 years now, at this age, is it
Mhm.
advisable for a woman to remove her womb at this age?
On what basis first? Let me be sure. Because when you say you remove your womb, you don't just wake up in the morning and say, okay, I'm old now, I want to remove my womb. There has to be a reason
According
why you do
to
some things.
what I say, according to the section I've done, I think this is the fourth one, and at my age.
Mm. That's what I said now. Mr. Taps, thank you. That's what I said. I hope that's Boss Jane, right?
Yeah.
Yeah, Boss Jane. That's what I said. I said there must be some real concern why hysterectomy is but if it's because they don't want you to be pregnant again, tubal ligation is part of the solution, right?
Okay.
Tubal ligation, because if you do tubal ligation, it means that you can actually still have your cycle, but just that no egg will be available for fertilization, so therefore no pregnancy further. You get?
Okay. Okay. Thank you very
So there
much.
must be, but I want you to make sure what you can do for me is to have a specific reason why that is being suggested. Is that okay?
Okay.
Yeah.
Okay.
But
Thank you.
please confirm to me now that you do not have any complication with your current pregnancy.
Yeah. My current pregnancy. No, I don't have any complication.
Good, good, good. It's okay. It's okay. It's okay. So, but
Okay.
if you think you also don't need the womb, you can as well take it out. But I feel like that will be an extreme measure where it is not necessary. Is that okay?
Okay. Thank you.
All right. So just make sure. Give me updates if there's any updates. Right?
Okay. I will.
You are
Thank you.
welcome. Queensley.
Hi, doctor.
Good to see you. How are you today?
I'm fine, thank you.
Talk to me. What's going on?
No, it's my first time coming up across the program, and being a professional in Nigeria. So when I heard when you said this Oyibo, then I bust laugh. Where are you taking your womb to? Where does it? If I thought you are even five, how many places do they inside and you want you to remove it? Please, so yeah, you don't get it back. When it's off, it's off. I'm sorry to add to your contribution. Don't
It's okay.
don't yeah, don't, my sister. They sometimes they just out of you have to be professional, Queensley. They just lazy. They just want to take easy decision, and when people doesn't know, they just put them there. That's why they're killing us here. It's not easy to
Mm,
get. You can get it back. You don't get your womb back when it's take off. Hysterectomy is. So be very, very careful, my sister. Even the fibroid is there. If they are doing your cesarean session, if they want to scrape the fibroid, they can. But do not, because you can get it back. Is when, just like what the doctor said, is when you are on a do or die affair, that okay, it's bleeding. This is a last option. No, you are
mm,
40s, four babies, and is deciding that on the table. No, you have to study your grants and ask him. He should really give you the total reason, and you want to go and find out. You want to do your findings. But at this time, you're not signing the consent form for that,
mhm,
because they can do what they want to do. And they say they just discussed it, and you didn't give them feedback, and they think it was the best suggestion for them. But it's never, because they always take an advantage of we blacks anyway. You know what I
mm,
mean? Thank you very much,
mhm,
doctor. I'm enjoying
mhm.
your program. It's my first time, and
Thank you very
that's all.
much.
Thank you.
Thank you very much. So
Yeah,
where are you streaming from?
from UK. I'm in
Okay, okay, okay.
Manchester.
I think you understand those people more than myself.
And you name it, so that's it. That's what it is.
I know, right? One time there was time I was discussing um this placenta issues one time, right? So I got to know that those people that give birth abroad, unlike in Africa, when you deliver, your placenta is given to you.
Hmm.
Whatever you do with it, nobody, it doesn't concern anybody. But over
Hmm.
there, I was told, I don't know, that you don't even
We
get to
never
see it. You
seen it.
don't know what. Oh my God.
I don't even know where my baby's
He,
placenta is. You never seen it. It's gone. It's
oh
gone.
boy.
Oh.
He Here, placenta is sacred. Eh?
Hmm.
You hold on to somebody's placenta, they will
Hmm.
fight you. What do you want to do with my placenta? So it's really awkward when I hear. In fact, you don't even get to see it. But again, I that caught my attention because there's a lady. I think she's a black American. She had a post where she was saying that some people can be very rebellious.
Yeah.
That she requested for her placenta and she held on to it for a few days until it was almost bad. It was already bad, sorry, before she released it. And the people were offended at her, right? So she said,
Hmm.
if it was that important to them, why don't they want it when it's bad?
Oh gosh.
Right? So now that gives credence to the fact that placenta is big business in the West. Big business because of this um, stem cell extraction and stuff that they use for their cosmetic
Yeah,
and all those things
yeah. They don't
that they
even,
do.
when you come here, a lot of things we don't know. At the time I
Yeah.
started realizing that, maybe I could have a point and ask, I need to get the placenta of my baby. It's already late because I was not saying,
It's already
what did
late.
they do with it? Where is it? They say no,
Mm.
is they have already passed that stage. Or what they were was, my baby is okay. They have I said, but where is the placenta? They say they don't discuss that one. They have like been it. They have done what you know what I mean. The time I remember
Mm-hmm.
that, they collecting this thing and collecting used to do whatever they want to do with their medication and get all their
In
thing.
fact,
And
in fact, somebody said to me one time, he said, "Do you know that that thing can sell for as much as $35,000? That much." So these guys are doing big business for every.
business.
Oh boy, oh
Because
boy.
you will not even the way you enter the system. One, you're trying to sort. You have already sorted yourself. You got your papers, or you are happy because you have not had baby. Okay, but the time you realize that in home they give you, we adored it. They say, where
Mm-hmm.
is the placenta? They say no, they don't give placenta. So what did they do with it? They said it's gone. Where?
He's gone.
It's gone. Ah, I was like this. The time after that, I have not strong. Like I can claim my rights. I know.
Mm-hmm.
Now I could have read down on the consent form. I need my baby placenta. They should give me. I'll go. There's a way we bury it in Nigeria. I'll go and do whatever I want to do with it. But
Mm-hmm.
a lot of things like that happen, and they just get away with it, and they just making their business. They are using it,
Yeah,
but
yeah.
nobody
Now when
like.
you are there for the first few years, there are certain things that really not concern you. You just want to
Mm-hmm,
focus on how to stabilize and stuff like that. But
mm-hmm.
again, it is what it is. That's what is happening basically. But most people
Yeah.
don't know, But now we know. I
Now
know
we
that
know.
I cannot really survive in that kind of society because I asked a lot of questions. My kind of person, I would have been in jail by now. I will ask, I will query, what is really going on, but it's fine. I hope you guys are maximizing your time and your life
Mm-hmm.
there. You know,
Yeah.
thank
Thank
you very
you.
much,
You're
Queensley. I
welcome.
appreciate
Yeah.
you, Mr. Tabs. Thank you very much. Okay, Debbie, come up. Debbie is the one that asked that question.
Good evening, sir.
Hi, Debbie. Good to
Yes,
see
good
you.
evening. Thank you,
Good evening. You're
sir.
welcome.
I've been listening to your program. It's quite an interesting one.
Thank you very much.
Okay, I asked a
So
question
talk
earlier
to
on. I
us.
said, yeah, I asked a question earlier on. I said, what are the causes of placenta previa?
Previa.
Previous, sorry, yes.
And that's why I said it's a very important question. I like the way, when you are not conversant with the thing, the way you people ask the question is very interesting. But again, it's good. I'm going to answer you. Well, let me see. Let me follow you back. All right. So, oh boy. Now, I wish you were here because I've done a lot of discussion on fertilization, implantation, and all that, and development that follows. But just to shorten for the purpose of your question, now, when implantation takes place, the embryo right? The embryo sticks to the wall of the endometrium, then digs into the wall and implant itself, right? When that happens, several changes, including establishment of blood vessels and all that, including the beginning of placenta formation, at that spot will begin. Now, some rather, implantation is not usually in the same location for every individual, for everybody. Some people have implantation at the fundus, some have implantation at the anterior wall of the uterus, some have implantation at the posterior wall, some may not be lucky at the lower segment of the uterus, and some much, much lower, close to the internal host. Ah, she's gone. Oh. Confirm to me that I'm not talking to myself, Debbie.
No, so I'm here. I'm here. Sorry, I have a bad.
Okay. So now, if implantation happens close to the internal host is the area just before, in fact, the beginning of the cervix. Is that okay? So if implantation
Yeah.
occurs close to that area, by the time placenta is formed, because placenta forms and is a large structure, right? So it can develop, spread out, and covers that internal host. So the
Okay.
covering of the placenta over the internal host is what placenta previa is. So placenta previa is not a disease. It's not a disease. It's just an anatomical presentation based on where implantation occurs. Is that okay?
Okay. Okay. Please,
Mm-hmm.
does it in any way affect the baby?
No, it shouldn't. Now, the only time placenta previa becomes a problem is at the time of delivery, right?
Okay.
Because unfortunately, because it is presenting itself, the baby has to push its way through the birth canal, the cervix. But unfortunately
Yes.
now, the placenta is now in the way of that birth canal. The baby will now be pressing against the placenta, pushing against it, causing a lot of bleeding that may even take the life of the mother. So that is why placenta previa is not a good thing. Do you understand?
Okay. Yes, sir.
Yeah, so it's just a placenta that presents itself close to the cervix, and at the time of birth is coming before the baby. That's the simplest layman's language I can use. It's coming before the baby. So that pressure the baby is coming with will cause a lot of bleeding from that area, and the mother will be at risk. And by the way, by the time you go for ultrasound scan, your doctor, once they see you have placenta previa, nobody will ask you to go for normal vaginal delivery.
Yeah, my
They will.
cousin's sister, she's having the same issue and she's in her third trimester.
Yeah.
So when she went for ultrasound, they said she's having placenta previa. That is, the placenta is showing first before the child. That she has
Mm-hmm.
to undergo a CS section, but she's refusing.
Yeah.
That she wants a natural
Ah.
VG bait. So that is why I said let me ask. But I've been asking questions and people have been telling me it is a very risky one. You should just advise her to go for the CS process.
Tell your sister to go for CS, please. If she
Okay.
wants to still be in this world with us and her baby.
Okay.
There is nothing like God can do it. It is God
Yes,
that is
sir.
giving us the knowledge for CS. So this CS is still God's doing. Is that okay?
Yes, sir.
So She does not have any problem. It's just that the placenta is going to cause a lot of problems for her by reason of, hey, nurse media is here. So please beg your sister with everything that you know to go for CS. It is not, she's not doing anybody favor by that CS. She's doing herself a big favor. Is that okay?
Okay, sir. I will. Thank you very much. I appreciate.
You're welcome. So who has a question? Before we go away, if you are just joining, please make sure you connect, you claim your points, drop your heart me, claim your points, right? It's very important. If you are just joining, drop a heart me, claim your points before we go. So, but if you don't have any question, we're about to go. We've entered second trimester pregnancy, and we're going to look at all the issues in details. And when we are done with second trimester, we will go on to talk about third trimester until we deliver the baby. Right? So by the time we get to the 40 weeks of pregnancy and we're done with all that, we will now go back and start from the beginning again, where we tell people what to do before they start trying to conceive. The things we've taught in this episode, in this season, the things we've taught, people have come with their testimonies of pregnancy positive. What are you waiting for? It's your time to be pregnant. All right? If you are a TTC couple, it is your time to be pregnant. All you need is knowledge. Knowledge will change the story. Right? And trust that you'll get all the story in details here. So if you are just joining, we'll give you a few minutes for those who want to claim their points. We'll claim your points, and it's time for us to go. Tomorrow, 7 p.m. Nigerian time, we will continue our second trimester pregnancy discussion. Hello, Esther. How are you?
Some news breaks hearts like glass on stone. I see the fear.
Hi, Lile Masoma. How are you? Good to see you. Flourish, baby. I see you. Felicity Best.
Some come back smiling, some never do. Some I can't forget, some I pray for too. They say I help, but they help me see. This work's a blessing wrapped in mystery. It's a joy and a storm, it's hope and it's pain. Tears in the sunshine, love in the rain. Every scan's a story, old souls and new. I'm just the witness in the heartbeat blue. Today I saw heaven, today I saw loss. Some dreams took flight, some dreams got crossed. Still I thank the stars, and I stand true to the silent songs of the heartbeat.